Hello, welcome to Onco Talks. I am your host Dr. Gargi and today I am with Dr. Bharat. We are going to talk about cervical cancer and with a particularly interesting discussion on cervical cancer screening. So, Dr. Bharat Patodiya is a medical oncologist, is a founder of Pi Cancer Care, which is a chemotherapy daycare centers in Hyderabad.
Namaskar. Thank you for inviting me and I am very grateful, and we will try to keep this discussion very interactive and useful for people, something which they can use in their life today. So with that intention, I am all here. Please ask me any questions which you have. At the end I will give my message to you.
Okay. Thank you for your introduction. To start with, please tell us about a little bit about cervical cancer.
Okay. Many people get confused. Where is this cervical cancer? Because this area is also known as cervical area. Cervical spondylosis. So understand that cervical cancer is actually an organ of female genital area, which is somewhere here in the pelvis. This hip bone is a cup type thing, that is where uterus is lodged, and the opening of the uterus is what makes cervix. Cancer of this opening area is known as cervical cancer. So no relationship with neck. It is cancer of female organs.
So, Dr. Bharat, can you tell us about different stages of cervical cancer and how it is important to know about cervical cancer, which will help people to make decisions for the treatment?
Okay, answering with your first question, different stages of cancer. As with any cancer, for example, just to explain, breast cancer, stage 0 is when by any scan you cannot detect a cancer, but the cancer has started forming in the body. So this is the earliest most stage of any cancer. Same goes for cervical cancer also. When we do a certain test like pap smear, the cancer has just started. You do a scan, everything is normal, but if you do a pap smear, you can see abnormal cell. That is stage 0, and that is our goal, to pick up cancer as early as possible. The next stage is when on a scan you can see something. On a female oncologist or a person examines the cervix, they can see a ulcer, they can see a lump. So that is stage 1. Stage 2 is when this lump increases in size, but it's still limited to the cervix, limited to that area. If around that area lymph nodes get involved, for example in breast, if the lymph nodes start getting involved in the armpit, that is late stage 2, stage 3. Similarly in cervix, if the cervix lip, opening of the uterus, and along with that lymph nodes in this area is involved, that start becoming stage 3. While surrounding organs, like in the same area there is rectum where stools are there, in the same area there are bladder, if those are touched, or the bones of the hip start getting touched by the cancer, it becomes stage 4. And if the cancer has spread anywhere else in the body, that makes stage 4 cervical. Number 2 was
So how knowing the stages and different treatment options available help them take decisions for the treatment?
So your question number 2, which says why to pick up early, why stages are important, what should we know? While stage 0, near 100% patient can be cured. Stage 1 only 90% get cured. Stage 2 maybe 70 can cure. Stage 3 only 50% can get cured. And stage 4, it is difficult to control cancer. And literally impossible to cure cancer. And that is why it is important to pick up as early as possible.
Okay. So now we know the importance why we should detect the cancer early. So going to the next question. So if someone gets diagnosed with cervical cancer, what their family or friends they can do?
So the role of family members and friends is crucial.
Their role starts from the very early stage when cancer is in stage 0. Their role is motivate this age group 21 to 65 years to get their screening done. That is what their role is. If a cancer is diagnosed, and then if you ask me the role is to get the proper treatment done. Also, nowadays we also detect cervical cancer by pap smear. Along with pap smear, we do HPV test. HPV test is done by RNA or DNA sequencing for the virus. Now, this HPV is spread by sexual route. So, when a cervical cancer is detected or a HPV test is positive, that is where the role of your friends and family member comes. You must not, they must not put a stigma on the patient. You know, how did this cancer come? How did this HPV infection come? I've seen people blaming the person who is developing this cancer. So this is where the role is most important. You have to be supportive in early diagnosis. If you start blaming, you start asking questions, you become judgmental, you become opinionated, the next generation of people will not go for early detection or this co-detection. We call it co-testing. So pap smear, which is a simple spatula based scraping, and on the pap smear we do from microscopy and this DNA or RNA of the virus. Now, if a cancer, the role of family friends in advanced stage is basically supportive. Cervical cancer patient life is not easy. They are full of symptoms, and symptoms which is difficult to share. They already have a pelvic burning, pelvic pain, weight loss, difficulty in passing motion, difficulty in passing urine. So that is where role of friends and family comes. They have to be understanding. Oh, this patient is undergoing cervical cancer treatment, or she is suffering from cervical cancer. Those symptoms are common. Be supportive. I have seen patients, family members, or friends making a person feel guilty if they are going to washroom again and again because they feel pain or they feel irritated feeling in the pelvis. So it's very important in the supportive ecosystem of the patient.
So from that I understood that so if someone gets diagnosed with cervical cancer, the family and friends they can be supportive from the screening. Like they can tell the family members to get screened, and that is the first point of care or first care they are showing towards their
Yes.
family members.
Yes.
And throughout, if they get diagnosed throughout the journey, they should empathize with the patient.
Correct.
And know how they feel so they can support them fully.
Yes.
Don't create any opinions about their nature or anything like that. Don't do that. And in advanced stage, of course, symptoms of cancer they should understand.
So going to the next question, if you can shed some light on why it is important to get screened.
So the role of screening is to pick up disease as early as possible. You know, cancer don't happen like this. It takes some time. So abnormal cells develop. We don't do anything. We don't remove the reason why they are developing. Then they start growing in size. We don't do anything. We don't get screening done. Then they increase further in size and they start learning how to spread in the body. So earlier you screen, better it is. Higher chances of cure rate.
Okay. So getting screens usually save lives. So
Yes. Screening saves lives.
So instead of getting detected in stage 3 or stage 4, the patients usually get detected in stage 1 and 2, which are curable.
Yes. What I will want to say is don't wait for a symptom to develop. In cancer, especially in cancer, if a patient has developed symptoms, it has crossed at least stage 2. So the stage 2, 3, so don't wait for symptom. When you are expected to come for screening between this age group of 21 to 65, get yourself screened at least once in 3 years or on annual basis.
Okay. So in the previous question, you told something about HPV test and pap smear.
Yes.
So if you can explain those.
Okay, so this is a uterus. Pap smear is basically kind of spoon spatula type of thing, which very simple procedure in OPD basis it can be done. We do a scraping, scraping. This scraping goes to the lab under certain stains, microscope. It is checked by eye. With this eye we can see, okay, cancer cells are present or not there. On this scraping we also do certain advanced tests by what we call sequencing. There are different methods, but with this sequencing you can detect if HPV virus is present or not. This HPV virus causes cervical cancer in more than 95% of cases. So if HPV virus and especially high risk strains are present, then we have to test the patient, screen the patient more frequently. And if HPV is absent, we can, I'm not saying to become callous, but you can increase the gap between the screening process.
So what is the difference between the HPV test and the pap smear?
So pap smear is basically under microscope. You see by eye with magnification after putting certain stains, certain chemicals which give color to cancer cells. While DNA and RNA sequencing is an advanced test. So in corona time you have seen this PCR, RT-PCR, similar method. You can detect what are the DNA of the virus is present or not, and in what quantity, very high, small, which strain. There are around 8 strains, out of which 2 is most risky to develop cervical cancer. So which strain is present? So all those things can be detected.
So as you said, 95% of the cervical cancer is caused by HPV virus.
Yes.
So is there any way to prevent getting HPV infection?
Why does cervical cancer happens and how this HPV virus infection happens? HPV virus is transmitted by sexual route. Simple. There is no other way HPV is transmitted. So of course it makes sense. Safe sexual practice is what you can practice. Have a single partner. Lifestyle is different. Single partner may not be possible, and you don't know the single partner whom you are is single to you or towards you or not. No problem. Use barrier methods. Barrier method like condoms, which could be for female condom or male condom, and most importantly for your children especially who never got exposed to sexual activities, get cancer vaccine against this cervical cancer. So this vaccine can protect more than 90% of the children in their teenagers. So get them vaccinated in teenage so that tomorrow they don't get exposed to this particular virus through unprotected sex or similar lifestyle problem.
Okay, just now you said about vaccines. So if you can give us a brief intro or brief discussion about the cancer vaccines which are available in the market.
See, this vaccine used to be known as cervical cancer vaccine, but I think that's a misnomer, because now this vaccine is approved for male as well as female, because this HPV virus can cause infection in males also and can cause cancer of male or genital organs like penile cancer, penis cancer or anal cancer, because these are all urogenital organs. So this should be given to male and female, ideally in their teenage. So if you are giving it before 14 years of age, only 2 doses are good enough. But after 14 years of age, if you are giving, then you have to give 3 doses, like first dose 2 months later and again 4 months later. So with that you can protect 95% of viral infections. So earlier you take in life is better. I have taken my vaccine at age of 35, but you never know. So no problem in that. You should get the vaccination done.
So from this discussion I understood that it is important to get screened and vaccinated. So what are the tips you will give to someone who has never undergone any screening test? So is there anything to fear, any precautions to take, etc.?
So somebody who is never screened between age of 21 and 65, understand, out of all different type of cancers screening programs, pap smear is the easiest, safest and most comfortable. Colon cancer, you have to do colonoscopy where a tube goes in from your anus to your intestine. you need sedation. For gastric cancer, you need endoscopy. Again, invasion, discomfort. But for pap smear, it's a OPD basis. You need not to be fasting. You need not to be. You need not to stop any medicines of your. You are taking cardiac medicine, diabetes medicine, thyroid medicine. No problem. It's a OPD procedure. You lie down, and just as an examination, a simple spatula goes in, scraping and come out, and that goes for testing. It hardly takes time. It it is absolutely not discomfortable. So why not get it done today? So that is my message to you. Don't be afraid of cancer screening, especially cervical cancer screening, because it is easiest and one of the most effective also. We can actually detect cervical cancer in stage 2 if you do a pap smear at the right time and you with co-testing HPV DNA is positive or not.
So with this, we have come to an end of our discussion. So I want you to give us some take-home message. So it will encourage people to get screened and vaccinated more.
Take home message for cervical cancer is 2 words: vaccine, screening. So get yourself vaccinated today, get yourself screened today if you are a woman between 21 years of age and 65 years of age. Meet a cancer specialist today.
Thank you, Dr. Bharat. Thank you everyone for watching. Stay tuned for next updates. We'll come up with more episodes like this to get you educated. Thank you.